Dear students, good afternoon to all. Hope you all are fine. Today's our offline class is about the mechanism of breathing. Out of mechanism of breathing, we are just going to deal about the expiration. What expiration is? It is the moving of air out of the lungs if the pressure within the lungs is more than the atmospheric pressure. Relaxation of the diaphragm and the external intercostal muscles returns the diaphragm and sternum to their normal thoracic volume and thereby pulmonary volume. Diaphragm. The relaxation of muscle fibers of diaphragm causes it to come in normal position, which reduces the volume of thoracic cavity. Decrease in the volume of thoracic cavity leads to similar decrease in the volume of pulmonary cavity that causes increase in the pressure of pulmonary cavity that causes expulsion of air from higher pressure lungs to lower pressure atmosphere. Now the forceful expiration. We have ability to increase the strength of expiration. It is due to contraction of internal intercostal and abdominal muscles. Now internal intercostal muscles. Contraction of these muscles leads to the pulling of ribs downward and inward, decreasing the volume of thoracic cavity. Decrease in the volume of thoracic cavity leads to similar decrease in the volume of pulmonary cavity, causes increase in the pressure of pulmonary cavity that causes expulsion of air from higher pressure lungs to lower pressure atmosphere. Now, abdominal muscles. Abdominal muscles contract, thereby compress the abdomen and pushes its contents towards the diaphragm. Therefore, volume of thoracic cavity decreases that leads to similar decrease in the volume of pulmonary cavity that causes increase in the pressure of pulmonary cavity that causes expulsion of air from higher pressure lungs to lower pressure atmosphere. Now the route of air during expiration from alveoli to bronchioles, then to bronchi, to trachea, to larynx, to pharynx, to nasal cavities, to external nostrils for outside atmosphere. Role of muscles in inspiration and expiration. Stage of breathing, muscles involved, contraction oblique relaxation, volume of thoracic cavity. Now, stage of breathing, this is normal inspiration, muscles involved are diaphragm, external intercostal muscles, they contract, volume of thoracic cavity increases. Now, normal inspiration, external intercostal muscles, they contract and volume of thoracic cavity increases. Now, the normal expiration, muscles involved, diaphragm relaxes and volume of thoracic cavity decreases. Normal expiration, muscles involved, external intercostal muscles relaxes and volume of thoracic cavity decreases. Forceful expiration, muscles involved, internal intercostal muscles, they contract and volume of thoracic cavity decreases. Abdominal muscles, they contract and thoracic volume that decreases. The rate of breathing in a normal healthy man is 12 to 16 times per minute. An instrument known as spirometer is used to estimate the volume of air involved in breathing movements, which helps in clinical assessment of pulmonary functions. Next will be in our next class.